Hi students, today let us discuss about some important aspects of anthropometry with respect to in pediatric children. Definitely one question will be asked from this. Okay? Right. Remember, the growth always happens in cephalocaudal direction. So what does it mean, cephalocaudal direction? It means the growth of head will start first, followed by growth of hand, followed by growth of lower limb, in that way. So this is called cephalocaudal direction. What is this called as? Cephalocaudal direction. Growth usually occurs in cephalocaudal direction. And also it is distal to proximal. What is called distal to proximal? Distal to proximal. What do you mean by distal to proximal? The growth of hand occurs before the growth of hand occurs before the growth of forearm. Before the growth of forearm. This is how it happens. So that is called distal to proximal. And remember, as far as the growth is concerned, we can have growth with respect to lymphoid, growth with respect to genital, growth with respect to head, everything. Almost 65% of the head size of an adult is present at birth itself. 65% of head circumference is present at birth itself. And one important point here is, look at this, the lymphoid growth is maximum between 4 to 8 years of life. I repeat, lymphoid growth is maximum between 4 to 8 years of life. That's why you get tonsil, you get adenoid, everything between 4 to 8 years. This is quite normal. And remember, the circumference of the head is achieved maximum by about 2 years itself. The adult head circumference is somewhere around 52 centimeter. The head circumference of the child at 2 years is 50 centimeter at 2 years. The gonadal growth usually starts after puberty. So this is the normal thing with respect to pediatric age group. It is always cephalocaudal and distal to proximal. Lymphoid growth is maximum between 4 to 8 years of life. Head circumference is 65% at birth, and at 2 years it is 50 centimeter. The head should always be measured. I repeat, the head should, what is this? This is called infantometer. Infantometer is to measure the length of the child. Length of the child means less than 2 years. Less than 2 years, we use the word length, and more than 2 years, we use the term height. Length is measured by means of infantometer, less than 2 years, and height is measured by means of stadiometer. Remember, the Frankfurt plane will be in the straight line. That is the line joining the floor of the ear canal to the floor of the orbit. That should be in the straight line. At birth, a child is usually 50 centimeter. And by about 6 months, the height is around 65 centimeter. By about 1 year, it is around 75 centimeter. By about it is 75 centimeter. By about 2 years, it is around 87 centimeter. By about 3 years, it is around 95 centimeter. By about 4 years, it is around 100 centimeter. It is around 100 centimeter. So this is very, very important. So the height of the child at birth is 50 centimeter. By about 4 years, it becomes 100 centimeter. Remember, the height of the child at 4 years is 100 centimeter. And very, very important point, between 6 years to 12 years, I repeat, between 6 years to 12 years, the height is usually 6 to 12 centimeter per year. The height is usually 6 to 12 centimeter per year. But when you have a height of less than 4 centimeter per year, when you have a height of less than 4 centimeter per year after 6 years, either it is growth hormone deficiency or it is thyroid deficiency. The rough formula to calculate height between 2 to 12 years, 2 to 12 years is age into 6 plus 77 centimeter. For example, a 2-year-old child will be age. A 2-year-old child will be 77, age into 6. So 2 into 6, 12. So 87 centimeter. This is the rough calculation that you need to know. I repeat, for pediatric age group, length means less than 2 years. It is measured by means of infantometer. Height means it is more than 2 years with the help of stadiometer. Between 6 to 12 years, the height should be more than 4 to 6 centimeter per year. Any height increment of less than 4 centimeter per year, you need to rule out an endocrine cause of short stature such as either growth hormone deficiency or thyroid deficiency. 1. So this is with respect to height of the child. Second, then comes the weight of the child. So how to measure the weight of the child? See, these anthropometry are very, very important whenever you attend a Viva OC in your pediatric examination, and also one question will definitely be asked in your entrance examination. So we have seen about height of the child. Now let's see about how to measure the weight of the child. Weight of the child should always be measured with a digital weighing machine so that it will be accurate enough to get your weight in terms of grams. Please do not use this spring balance for weighing the to weigh the child. You need to always use either infantometer with a digital weighing machine or a simple digital weighing machine, right? So what is the let us see about the weight of the child at birth. The weight of the child at birth, I repeat, the weight of the child at birth is usually 3 kgs. And in the first 10 days, very, very important, in the first 10 days, they lose weight about 10 grams. They lose weight about 10% of their body weight, and they will regain their body weight by about 10 years. This is very, very important. In the first 3 months, I repeat, in the first 3 months, the weight of the child is roughly around 900 grams per month. The weight gain is 900 grams per month. After 4 to 12 months, I repeat, 4 to 12 months, it is around 400 grams per month. It is around 400 grams per month. And by about 6 months, it is birth weight into 2. What is birth weight into 2? So by about 6 years, birth weight into 2. What is birth weight? 3 kgs. So birth weight into 2 is roughly around 6 kgs. Then by about 1 year, it is birth weight into 3. That means 9 kgs. At about 2 years, birth weight into 4. That means 12 kgs. Birth weight into 4, that means 12 kgs. By about 3 years, birth weight 3 kgs into 5, that means 15 kgs. Then by about 6 years. Okay. Then by about 5 years, 5 years birth weight into 6, that means 18 kgs. And by about 7 years birth weight into 7, and by about 7 years, by about 10 years birth weight into 10. So birth weight 7 into 3, 21 kgs at 7 years, and then 3 into 10, 30 kgs at 10 years. So this is the simple formula to calculate the expected weight of the child. I repeat, by about, okay, by about 6 months into 1 year into 2, 2 years into 3, 3 years into 4, 4 years, and then 3 years. At about 5 years into 5 into 5, and then 7 years into 7, and by about 10 years into 10. So this is the rough calculation to find out the expected weight of the child. Expected weight of the child, right? Now comes the head circumference. So what is this head circumference called as? The head circumference, otherwise known as it is otherwise known as occipitofrontal circumference. It is otherwise called as occipitofrontal circumference. So you need to measure by covering the occiput posteriorly and the supraorbital margin anteriorly. This is called occipitofrontal protuberance, occipitofrontal circumference. What is the normal head circumference at birth? At birth, it is somewhere around 35 centimeter. In the first 3 months, it is usually 2 centimeter per month. 2 centimeter per month. So what happens? By about 3 months, the child is around 35, 2 into 3, 6, 41 centimeter. And by about 3 to 6 months, it is around 1 centimeter per month. So plus 1 centimeter plus month. So it is plus 3 centimeter. So by about 6 months, the child is around 44 centimeter. Then between 6 months to 12 months, it is 0.5 centimeter per month. So roughly around 3 centimeter. As a result of which, at 1 year, the child head circumference is somewhere around 46 to 47 centimeter. So at birth, the child head circumference is 35 centimeter. After 3 months, 41 centimeter. 6 months, 44 centimeter. By about 1 year, 46 centimeter. By about 2 years, 48 centimeter. By about 2 years, 48 centimeter. By about 5 years, 50 centimeter. And by about 12 years, it is 52 centimeter. Remember, if you have more than 1 centimeter per 15 days, I repeat, if you have more than 1 centimeter increment in head circumference in the per 15 days in the first 3 months of life, then you need to rule out hydrocephalus. This is called occipitofrontal circumference. Then comes the chest circumference. Chest circumference should be at the level of nipple. Chest circumference should be at the level of nipple, midway between inspiration and expiration. One. At birth, head circumference is more than chest circumference. So for example, if your head circumference is 35 centimeter, means your chest circumference is just 32 centimeter. So a difference of 3 centimeter will be there. But by about 1 year, your head circumference will be equal to chest circumference. So it will be roughly around 46 centimeter both. But after 1 year, your chest circumference will be more than head circumference. This is very, very important. If your chest circumference is less than head circumference after 1 year, it is presumed that the child is having severe acute malnutrition. So at birth, it is less than 3 centimeter compared to your head circumference. At 1 year, head circumference equal to chest circumference. After 1 year, your chest circumference will be more than head circumference. But if it doesn't happen, you need to rule out severe acute malnutrition. Then what is this? This is called mid upper arm circumference. This is called as what? Mid upper arm circumference. What is this mid upper arm circumference? So you need to take a point. So the first point is tip of acromion. The second point is tip of olecranon process. So the first one is tip of acromion. The second point is tip of olecranon. So in between you need to take the midway. The midpoint between the tip of olecranon and tip of acromion is the place where you need to take mid upper arm circumference. Why it is called upper arm? In abroad, that is in UK, US, they use this area. They will call this area as called as upper arm, and this area is called as for lower arm. But in India, we call this is arm, this is forearm. That is why there is a confusion. So mid upper arm circumference. Mid upper arm circumference. What is the use of mid upper arm circumference? Normally between 6 months to 5 years for all children it is fixed. It should be more than 12.5 centimeter. The mid upper arm circumference should be more than 12.5 centimeter. If it is between 11.5 to 12.5 centimeter, the child is said to have moderate acute malnutrition. The child is said to have moderate acute malnutrition. If it is less than 11.5, the child is said to have severe acute malnutrition. The child is said to have severe acute malnutrition. So 6 months to 5 years it is fixed. More than 12.5 centimeter is called mid upper arm circumference. If it is between 11.5 to 12.5, it is called moderate acute malnutrition. Less than 11.5, it is called severe acute malnutrition. This is very, very important. And this can be measured with the help of a special tape called as Shakir's tape. What is this called as? This is called Shakir's tape. In that Shakir's tape, if it comes in the red zone, then the mid upper arm circumference is said to be less than 11.5 centimeter. And the child is said to have severe acute malnutrition. Then comes the teeth. You all know the primary teeth. Primary teeth is usually 20 in number, whereas permanent teeth is 32 in number, because you have additional 2 premolars and 1 extra molar. As a result of which you will get 32 temporary permanent teeth and 20 primary teeth. The first tooth appear in primary teeth is lower central incisor. Lower central incisor, which usually appears by about 6 months. By about 6 months. Whereas your last temporary tooth is your second molar, which usually appears by 18 months to 3 years. Whereas 18 months to 3 years. Whereas permanent teeth, the first teeth to appear is first molar by about 6 years, and the last tooth is third molar by about 18 months. 18 months. So these points are very, very important for your entrance examination. And remember, when you will call it as delayed eruption of teeth. I repeat, when will you call it as delayed eruption of teeth? When will you call it as delayed eruption? It means there is no teeth by 13 months. Very, very important MCQ. No teeth by 13 months. So this is an important MCQ. Delayed eruption means no teeth by 13 months of age. That is called delayed eruption of teeth. And what are all the causes for delayed eruption? Causes. The causes are rickets, Downs, hypothyroidism, as well as hypoparathyroidism. The causes for delayed eruption of teeth is rickets, Downs, hypothyroid and hypoparathyroidism. At times you can have early teeth, early eruption. Early eruption is usually can be normal, but at times it can be a manifestation of acute lymphatic leukemia or Langerhans histiocytosis. They are all some malignant tumors of the children. So with this, we had completed our basic discussion with respect to your growth parameters, your height, weight, head circumference, chest circumference, teeth, as well as mid upper arm circumference. Thanks for your patient listening. Bye bye.